When we remove a patient's cataract, if we did nothing else, they wouldn't be able to see because we removed the natural lens from the eye. Of course, it's a cloudy lens, that's why we call it a cataract, but that's only half the procedure. The second half is replacing it with a lens implant. And well before the patient has their cataract removed, we will have already had a very in-depth discussion regarding lens implants, which one I may recommend to them based on the health of their eye, the shape of their eye, other diseases they may or may not have, to try to tailor the fit of the lens to a visual outcome. For example, a very common thing that patients have is astigmatism. A third of Americans have a significant amount of astigmatism. So for those patients, there are astigmatism correcting lens implants. So I may recommend that lens to that type of patient. There's other patients who are very active. I've had a patient who loved to sail. So he wanted to be able to be on his boat, seeing things far away, where's the pier, looking at his dials in the boat, and he wanted to be able to do that without glasses on. He didn't want water splashing up on him and interrupting his vision. So for that patient, I recommended a crystal lens, which is a type of a lens implant that can help you see out in the distance and help you see up close and enable you to do those activities without glasses. So we really try to marry both the physical constraints or needs for the patient's eye with a lens implant, but we also superimpose the patient's lifestyle and the patient's desires. We try to kind of marry the science and the lifestyle with the lens implant to get people seeing the way that they want or need to see. One of the lenses we're excited about and we've been using for the past few years, it's a relatively new lens implant. It's called an HD lens implant. It's unique in that the size and the shape of the optic is large and it's oval shaped. It tends to really help cut down on glare at night. It improves contrast sensitivity. The other great thing about this lens is it comes in twice as many power increments as other standard lenses. So again, really just trying to fit the proper lens and the proper lens power to the patient's eye. That's been an outstanding lens. We use a lens called a Toric Lens in many patients. A Toric Lens is a lens implant that can help reduce astigmatism. It's a big problem. About a third of the population has astigmatism. The Toric Lens has been just amazing for these people. Some of these patients have really thick glasses. Some of these patients have needed to wear hard contact lenses to help treat their astigmatism prior to their cataract surgery. And when we implant the Toric Lens for these patients, it's a game changer. It changes their vision. They see better than they've ever seen. So I've really enjoyed using that lens implant over my career. Another lens that's very exciting is a multifocal lens. The multifocal lens that I tend to use is called a Restore. This type of lens implant, I think, gives the patient the most freedom from glasses. So for the patient that really wants to get away from their glasses, they don't want to wear reading glasses, they don't want to wear any glasses of any sort, the multifocal lens implant, I think, really achieves that for these patients more so than any other lens. It has multiple zones of focus within the implant, so it enables people to see far away, and see 15 feet away, and see at their computer screen, and see up close at their hands. So that's been a very exciting implant I've had a lot of success with, and patients really, really like that. The crystal lens is another lens implant option that's available to the patients. It's called an accommodating lens implant. It's a very unique platform in that it has a small optic which the patient sees through, and it's on a flexible platform. So this lens implant utilizes the patient's focusing muscles inside their eyes to help the lens implant focus far away and bring their focus up. It tends to be a very good lens for distance vision and intermediate vision in particular. We refer to computer type distance as intermediate vision, and this lens implant gives both of those really nice. So it reduces patients' need for glasses. They tend to be very happy with it.